Anatomy and physiology of teeth. Let's move on to the chapters. Teeth. Teeth are the odd structure in the mouth that have two main functions, one for breaking down food for digestion and assisting speech. Humans typically have two sets of teeth in a lifetime: 20 baby teeth, deciduous teeth, 32 permanent teeth. They are comprised of four types of tissues: enamel, dentin, cementum, bulb, and are divided into visible crown and a root embedded in the jawbone. Types and functions. Humans have four types of teeth, each with specific function: incisor for biting and cutting food, canines for tearing food, premolars for crushing and grinding food, molars for grinding and crushing food. Structures and functions. Crown. Crown, the visible part of the tooth above the gum line. Root, the part embedded in the jawbone, anchoring the tooth. Enamel, the hardest substance in the body. It forms the outer protective layer of the crown. Dentin, a hard yellowish layer that makes up most of the tooth structure. Cementum, a layer that covers the root and holds the tooth in place. Bulb, the innermost layer containing nerves and blood vessels that provides nutrition and sensation. Let's get into the questions. What is the hardest substance in the human body? Options A, dentin. Option B, enamel. Option C, cementum. Option D, bone. The right answer is option B, enamel. Enamel is the tough, shiny outermost layer of the tooth crown. It is made up of 96% of hydroxyapatite, a hard crystalline mineral that makes enamel even stronger than bone. It protects tooth from wear, acids, and bacteria. Because it has no living cells, enamel cannot repair itself. Regular brushing and fluoride helps keeps enamel strong. What is the visible part of a tooth above the gum line called? Option A, root. Option B, crown. Option C, neck. Option D, bulb. Right answer is option B, crown. The crown is a visible portion of the tooth that lies above the gum line. It is covered by enamel which protects the tooth from mechanical and chemical damage. The crown shape varies depending on the type of tooth. Incisors have sharp edges for cutting, while molars have flat surface for grinding. A health crown ensures proper chewing and speaking functions. Maintaining good oral hygiene helps prevent decay, discoloration, and damage to the vital part of the teeth. Which part of the tooth anchors it to the jawbone? Options: enamel. B, dentin. Option C, cementum. Option D, bulb. The right answer is option C, cementum. Cementum is a thin, bone-like structure that covers the root of the tooth and anchors it to the jawbone through periodontal ligaments. It provides stability and support, keeping the tooth firmly in its socket during chewing. Cementum continues to grow slowly throughout the life, allowing for minor adjustment in tooth position. It also plays a role in repairing the tooth root surface it becomes damaged. Without cementum, the teeth would lose their grip and become mobile. Which part of the tooth contains nerves and blood vessels? Option A, dentin. Option B, bulb. Option C, enamel. Option D, cementum. The right answer is option B, bulb. Bulb is a soft, living core located at the center of the tooth. It contains blood vessels, nerves, and connective tissues, which provides nutrition and sensation to teeth. The bulb is responsible for detecting temperature, pressure, and pain. If decay or injury reaches the bulb, it can cause inflammation and severe toothache. In such case, a root canal treatment is performed to remove the infected tissue while preserving the tooth structure. Which substance form the main body of the tooth? Option C enamel, option B dentin, option C bulb, option D cementum. The right answer is option B dentin. Dentin makes up the majority of the tooth structure and lies beneath the enamel and cementum. It is a hard tissue but slightly softer than enamel, allowing for some flexibility. Dentin contains microscopic tubules that connect to the bulb, transmitting sensations such as pain or sensitivity. When enamel is worn away, these tubules are exposed, causing discomfort. Using fluoride toothpaste and maintaining enamel health help protect dentin from damage and sensitivity. What is the junction between enamel and cementum called? So options A enamel dentin junction, option B cemento enamel junction, option C dentin bud junction, option D alveolar junction. The right answer is option B cemento enamel junction. The cemento enamel junction, often abbreviated as CEG, is the line where the enamel covering the crown meets the cementum covering the root. It marks a boundary between the visible and hidden portions of the tooth. This area is very sensitive because it can be exposed when the gums recede. If the CEG becomes uncovered, it can lead to the tooth sensitivity and tooth decay. Gentle brushing and good gum care are essential to keep this area protected. Which teeth are used for tearing food? Options A incisor, option B canines, option C premolars, option D molars. The right answer is option B canines. Canines are the pointed teeth located next to the incisor and are primarily used for tearing and holding food. Humans have four canines, two on the upper jaw, two on the lower jaw. These teeth have the longest roots in the mouth, giving them greater strength and stability. Canines also help guide the jaw during side movements while chewing. They play an important role in maintaining balanced bite and a natural facial shape. Which teeth are mainly used for grinding food? Options A incisor, option B molars, option C canines, option D premolars. The right answer is option B molars. Molars are the large, flat teeth located at the back of the mouth, designed primarily for grinding and crushing food into smaller pieces. Adults typically have 12 molars, including 4 wisdom teeth. Their broad surface area and strong root make them perfect for handling heavy chewing process. Because of the deep grooves, molars are more prone to cavities. Regular brushing, flossing, and dental cleaning help keep molar healthy and functional. Which bone supports the lower teeth? Option A maxilla, option B mandible, option C frontal bone, option D nasal bone. The right answer is option B mandible. The mandible or lower jawbone is the only movable bone in the skull and supports the lower teeth. It plays a crucial role in chewing and speaking, moving up and down and side to side to grind food. Mandible holds 16 lower teeth in sockets called alveoli. Proper alignment of the mandible ensures balanced bite and helps prevent jaw pain or temporomandibular joint disorder. At what age do first permanent teeth usually appear? Options A 2 year, option B 4 year, option D 10 years. So the right answer is option C, 6 years. The first permanent teeth, usually the first molars, begin to erupt around the age of 6. This stage is known as the mixed dentition period, when both primary and permanent teeth are present. The first molar appears behind the baby molars without replacing any of them. Early dental care during this stage is vital because it sets the foundation for the adult bite. Proper brushing habit should start as soon as the teeth appears. What is the last set of teeth to appear in the mouth? Option A, incisor. Option B, canines. Option C, premolars. Option D, wisdom teeth. The right answer is option D, wisdom teeth. Also called as third molar, are last to erupt, usually between ages 17 and 25. They are located at the very back of the mouth and were useful to early humans who needed to chew tough raw foods. However, the modern jaws are smaller, leaving little space for them to grow properly. This causes pain, impaction, or misalignment, and they need to removed by a dentist. Which part of the tooth is sensitive to temperature changes and pain? Option A, enamel. Option B, cementum. Option C, dentin. Option D, bulb. The right answer is option D, bulb. The bulb is the innermost part of the tooth that contains nerves and blood vessels. Because of the nerves, it is highly sensitive to temperature, pressure, and pain. When decay or damages reaches the bulb, it causes sharp discomfort or toothache. Proper dental hygiene prevents bacteria from invading this delicate area. If the bulb becomes infected, a root canal treatment may be required to save the tooth. Which is the first permanent tooth to erupt? Option A, central incisor. Option B, first molar. Option C, canine. Option C, second premolar. The right answer is first molar. The first permanent molar are usually the first adult teeth to appear, erupting around the age of 6. They grow behind the baby molars, do not replace any primary teeth. Because of this early appearance, they are sometimes mistakenly for baby teeth and may not receive proper care. These molars play a crucial role in establishing the permanent bite and alignment, so keeping them clean and healthy is very important. What is the process of tooth formation called? Option A, calcification. Option B, odontogenesis. Option C, eruption. Option D, mineralization. The right answer is option B, odontogenesis. Odontogenesis is a biological process through which teeth develop. It begins in the embryo around the sixth week of gestation and continues until the teeth appear through gums. This process involves formation of enamel, dentinal bulb, and cementum. Specialized cells like amyoblast and odontoblast play a crucial role in this development. Any disruption in odontogenesis can lead to dental abnormalities or delayed eruption of teeth. What causes shedding of primary teeth? Option A, jaw growth. Option B, root resorption. Option C, eruption pressure. Option D, gum thickening. The right answer is option B, root resorption. Root resorption is a natural process that causes baby tooth to loosen and fall out. As the permanent teeth grow beneath them, they press against the root of primary teeth, gradually dissolving them. Once the roots are dissolved, the tooth loses its support and eventually shed. This process allows for tooth replacement by permanent teeth, maintaining the correct order and spacing in the mouth. Which vitamin is essential for healthy gums? Option A, vitamin A. Option B, vitamin C. Option C, vitamin D. Option D, vitamin K. The right answer is option B, vitamin C. Vitamin C plays a vital role in maintaining healthy gums by supporting collagen formations in connective tissue. A deficiency in vitamin C can lead to scurvy, characterized by bleeding gums and loosened teeth. Since the body cannot store large amount of vitamin C, it must be consumed regularly through fruits and vegetables like oranges, strawberries, bell peppers. What is the main functions of the saliva in oral health? Option A, food digestion only. Option B, acid production. Option C, neutralizing acid and cleaning teeth. Option D, hardening plaque. The right answer is option C, neutralizing acid and cleaning teeth. Saliva plays crucial role in maintaining oral health by neutralizing acid produced by bacteria, washing away food particles, and providing minerals for enamel repair. It also contains enzymes that begin digestion and antimicrobial substance that control bacteria growth. A reduced saliva flow known as dry mouth can increase the risk of decay and gum disease. What is the pH level below which enamels begin to demineralize? Option A 6.8, option B 6.0, option C is 5.5, option D 4.0. The right answer is enamel begins to demineralize when the pH in the mouth drops below 5.5. At this level, acid produced by bacteria dissolve calcium and phosphate ion from enamel crystallize. Frequent acid exposure from surgery food and drink increases the risk of decay. Saliva plays key role in neutralizing acid and restoring minerals. Using fluoride toothpaste also helps strengthen enamel and against low pH damage. And the pH of the saliva is 6.8.